Hi, everyone. Thank you for attending this short talk. I'm Karthik Bhat, a PhD student at Georgia Tech, and I'm presenting my paper titled Sociocultural Dimensions of Tracking Health and Taking Care, co-authored with my advisor, Dr. Neha Kumar. Research on personal health informatics in CSCW and HCI has looked at how people engage in health tracking and analyze collected data. Fitbits, Apple Watches, and other wearable devices are becoming more prevalent, which has made health tracking more convenient and pervasive. This is being leveraged more and more in chronic disease management, among other contexts, because it allows patients to participate more actively in their care so that they can be more informed about their health. But personal health tracking is not always only personal and is often shaped by sociocultural and ecological factors that determine who can track and what they can track, among other things, which we explore in this study. We ask the question, what are the sociocultural dimensions that influence health tracking and patient-centered care? We conducted an interview study with 26 semi-structured interviews. 18 were with individuals who suffered from cardiac diseases. We asked them about their diagnosis, their interactions with their doctors, and their at-home care practices, including health tracking. The remaining 8 interviews were with cardiac care specialists. We asked them about their interactions with their patients and experiences with digital tracking of health data, both theirs and their patients. Our findings fell into 4 themes focusing on the technological, personal, interpersonal, and ecological factors that shape the adoption of health tracking behaviors. First, we laid out the affordances of health tracking technologies that were appreciated by our participants, like the irregular heart rhythm detection on Apple Watches. We also laid out reservations they held regarding its usage, for example, stemming from the lack of customizability of these features. Next, we presented their attitudes towards health information, how they relied on online information sources, and how they chose to access this information. We also found that this information engagement was staggered over time and among caregivers, so that the care was continuous and there was less information overload. We analyzed the dynamics of patient-doctor interactions in the context of health tracking, including how decision-making based on health tracking was outsourced to the doctors. Finally, we highlighted the cultural situatedness of health tracking behaviors. For example, how gender dynamics affected health tracking and collaborative caregiving. We also described how family dynamics informed these health tracking behaviors. We outlined 2 main takeaways in our paper. First, data-driven approaches to health tracking have mainly foregrounded the individual, with recent work highlighting other ecological factors. We show that there is a breadth of sociocultural dimensions that play an important role, and argue that collected data can lead to better health outcomes when these are taken into account. Second, we discuss how our findings tie into conversations on patient empowerment in HCI and CSCW. The focus of prior work has been to uncover ways in which patients can be more informed and therefore more in control of their health. We show how health tracking takes place alongside tensions stemming from sociocultural structures, and more information is not always more empowering. Please consider reading our paper where we present these findings and arguments in much more detail. I would love to hear your thoughts and questions now, or by email or over a coffee in person at some point later. Thank you.